dementia, connecting our lives to help us survive. So we spend our time to the fullest we can.
Hi, welcome to Professional Insights, created by Dementia Action Alliance. I'm proud to be your host, Laurie Scher. During our Professional Insights podcast, we have educational conversations with professionals in the dementia community to provide answers and support to people living with dementia and their care partners. My guest today is Dan Swiatkiewicz. We will be exploring how to select a care unit and understanding what type of care is best for your needs. Dan is the Vice President of Sales and Marketing for Christian Living Communities, a nonprofit living based in Englewood, Colorado. Dan is passionate about changing how we think of aging and changing many of the perceptions of senior living. He is the secretary of the Eden Alternative Board of Directors and an alum fellow of the Leading Age Leadership Academy. In his spare time, Dan is active in his local church, enjoys spending time outdoors with his wife and dog Scully, and enjoys a challenging Lego set. Dan, it's wonderful to have you here with us today.
Thank you, Lori. It's a pleasure to be here, and great job on the last name. You got it perfectly. So,
Thank you.
Job.
I nailed it.
So.
Thank you. Well, welcome. And we're going to get right to it because we have some questions for you. And I'm so pleased to have you because so many people have asked this. Okay, number one, how do we start looking for a care unit? And what determines what type of unit I should be looking for? Do I need a memory care, or assisted living? How do I know what direction to go in?
Yeah, that is a great first question for us to start with. And so what I would certainly encourage you to do is to start this process early. Start looking for a place, very early in the process. And what you want to do is evaluate what level of care you really need. So in our communities and most people in our field, we want you to live as independently as possible or in the least restrictive environment as possible. So I am a big proponent of continuing care communities, which have all levels of living. So that starts with independent living, and then probably usually offers assisted living and memory support, maybe sometimes also offers skilled nursing care, which is the highest level of care. And so the advantage to this is you can stay on the same campus and keep your friends and not lose those friends. And so I would just encourage you to seek that level of care where you can still function the highest level and still live your life as fully as you can. Although assisted living and memory care, you can still be your own person and live your life. Each level of care does get a little bit more restrictive. And so I would encourage you to look for that area of care that you think you can live most fully in and do your best job in. So if you're starting to see that maybe you need some help with what's called activities of daily living, so brushing your teeth, dressing, if you're starting to see that you need help with those things, you could still live independently. You could bring in some home health to help you. But if you're starting to find that that's really becoming a daily thing and multiple times a day, that's when maybe it's time to look at assisted living or a level of care like that. One thing that I would strongly and make very clear is do not let anyone sell you on memory care and that you need memory care just because you have a dementia diagnosis. That's definitely not the case. We have people, and I know people who live independently with living with dementia. People can live in assisted living and thrive with dementia. So if anyone tells you or your loved one that you automatically need memory care because you have a dementia diagnosis, that's definitely false. So I think, memory care may be appropriate for someone who maybe they're a danger to themselves or others. An example of this would be, you would walk away from the community and not be able to find your way back. And so in that situation, maybe you do need a little bit more of a restrictive environment. But just because you have a dementia diagnosis does not mean you need memory care. You could live very well in any levels of living. But I would definitely encourage you to start early, visit places multiple times, get to know the residents there, and start to find out where you belong and feel that sense of belonging in terms of where you want to live next.
Wow, thank you, Dan. And to To so many of us, the independence is important. That's why we try and come up with so many strategies on how we can make our life easier so that we can continue to live independently. So we we really are going to appreciate hearing you say all this. But okay, now I'm going to go with another question. So now we determine I don't need memory care, but I do need some kind of assistance. But there's so many choices out there. Even I live out in the country. My neighbors are cows or goats, but even here there are a number of choices. So before we spend a bunch of money or move into some place that we find we really are unhappy, is there a process to help us eliminate the choices and figure out what we should look for?
Yeah, so I think this goes back to, again, starting that process early, but I would sit down, whether you sit down by yourself or with a trusted loved one or friend, and make a list of what's important to you. And so many times you're going to visit a place and they're going to be focused on all these great amenities that we have to offer. And amenities are certainly important. And I think you should make a list of what amenities you feel like you would benefit from. So often they'll just try to sell you on the beauty of the community. And while a beautiful community is important, I think what's really important is this community going to meet my well-being? And so I would make a list of, what is important in the future, now, because you're obviously it can change over time, but what's important to my well-being? And what are those things that I need in my next home to still live well? And I would evaluate through that lens when you go into community and you're talking to people, evaluate through that lens of, is this community, is this senior living going to enhance my well-being? And so, for example, at the alternative, we use the 7 domains of well-being, and one of those domains is connectedness. And so, if connectedness is important to you, you probably want to look for a community that has a great life enrichment program, that has a strong sense of community, because that's going to help you keep your well-being with that connectedness. Meaning and purpose is important to you. Finding a community that's going to help you continue to live out that meaning and purpose is really important. So I would really evaluate it in terms of that list of how you can live well, and eliminate or elevate places based on that list. I would also encourage you to use your 5 senses when you visit a community, and you're probably like, damn, that's kind of okay, I get it, but I'm just saying, like, when you go into community, look at how the residents are being treated. Look at how, are they being well cared for? Do they look clean and happy? In terms of hearing, what are you hearing in the community? You're hearing life and laughter. Are you hearing good things? In terms of taste, you're going to be eating the food living in that community. And I would strongly recommend, whether you are a big food person or not, you try that food and see how it is. And, in terms of touch, our team members engage meaningfully with residents. Touch is so important in all of our lives. And, smell, does the community smell home? Does it smell like home? Are there odors that maybe are not pleasant that you're smelling? These can all be things that are, red flags, so to speak, that could indicate this is a good home for you or not. So I definitely say to use all your senses. One other practical consideration is just location. If your family members are going to be involved in your care, you may want to pick a place that's close to them, so it's easy for them to visit you and see you. But also, I would not make location the most important factor. I would not compromise anything on that list that's important to you just based on location, because ultimately you're not going to be happy there and probably want to move. So that's kind of how I'd evaluate. Just having that list is really, really important. And if your loved one is the one leading, this effort, so to speak, I would make sure that you advocate for yourself, that you're involved in that process. I've met with many family members who say, oh, my loved one has dementia, they can't be involved in this process. And that's absolutely not correct. You, as a person living with dementia, should be involved in the process. You should have a say. And you should ultimately have a voice, and the voice in making this decision. And so I think make sure your family members are taking you with you and touring you and involving you, because the lens they look through may be one of peace of mind for them and safety, that you're safe, which obviously is very, very important. But we want family members to look through the lens of what's best for my loved one, and you're the best person to advocate for yourself, no matter, you know, where your cognitive impairment might be at this point. You still have a voice in your next home.
Well, thank you. And that, boy, how true. We advocate strongly at Dementia Action Alliance on us continuing to have a voice always and forever. So very powerful. Thank you. And I know I went looking at a couple places so that I'd be prepared when, but two of the places I went to said they wouldn't allow me to continue scuba diving after I went in. So I decided I'm going to hold off on that. Yeah, no, they wouldn't let me continue. That was like,
That's a
seriously?
shame. That's terrible.
I know. But as we narrow down the process, is there specific questions that you would suggest that would help us in deciding, you know, what's a good one, what's a bad one, what do I fit? Now, I know I went around to some places with my mother-in-law, and there were places that you walked in and it was like, yeah, no, this is not going to happen. Sadly, the total smell in the place was just horrific. So smell, obviously, that's kind of easy to narrow it down. But what questions? How do I determine if these people are really going to have my same philosophy in mind, including
Yep.
nothing about me without me?
Yep. So a couple things I would say on that. You know, I would say that probably prepare some questions ahead of time that you want to ask that are important to you. Again, going back to that list of what's important to your well-being, have questions that you want to ask of how they're going to help you live life to the fullest, and see how they answer those questions. I'll be honest with you, there'll probably be some people you'll meet with who will not be prepared to answer those questions because they're not used to getting asked those questions, because they're used to people asking about the amenities and things like that. And so I would just listen to how they answer those questions and ask follow-up questions about that. So you know that this community that you're moving to is going to help you live your life to the fullest. I would also, you know, obviously you're going to ask the practical questions about rates and pricing. How does that all work? I mean, those are questions that you're going to want, those facts you're going to want to get. But I would also say asking about training and how they train their team members is very, very important. And I would not accept a surface answer on this if they say, you know, oh, yes, we have extensive training. I would ask, tell me more about that, because a lot of times you'll find it's like a couple courses online that they watch and there's no real engagement and there's no real creativity in terms of how that training works. So I think for someone living with dementia, asking those questions of what training looks like is also really, really important. I would also, and this may sound kind of different, but I'll also evaluate what questions they're asking you. So the salespeople are going to be asking you questions. And, you know, one question we ask at Christian Living Communities is, if you move here, how do you want to continue to contribute to life in our community? How do you want to help? How do you want to be a part of this community? Because there's really no research that shows moving into community and throwing your feet up and having everything done for you is good for aging. It's absolutely, it's not true. So we want people to know, we want you to come here and be a citizen and be an active part of the community. And so if you go to a community and you're getting asked questions that are all about your diagnosis, all about your medical care, all about your medications, that would be a pretty big red flag to me that this community is really rooted in the medical institutional model of care. And that's, quite frankly, not a place that you want to live, because they're not going to focus on you living well and living well with dementia. So I would also listen to what questions they ask you and just have discernment around those questions. And now, Lori, I know we had one specific question that I can go over here. Is someone asked ahead of time, if a new and disturbing behavior comes up, particularly one that distresses others in the community, how do you determine its cause or trigger? And how do you address it? And how do you insulate and protect other residents? So that's a very, very specific question. To me, this goes back to the training question as well. You know, I think we can all agree that the word behavior is a pretty dated word, very much again on that institutional medical model. If someone has a behavior, so to speak, it's really an unmet need, whether that person has dementia or not. There is some need that we aren't meeting in terms of what they need in their daily lives. And so asking that question, I would really find out, you know, how do they train their staff to look for that unmet need? If their answer to a behavior is a medication, that's again not a place that you you want to be living. And so really finding out, how they train their staff to meet that unmet need and how they address it and creatively find ways to learn from that resident or learn from the family how it might be helped is going to be really key. If you hear the word behavior a lot, I would be cautious to move to that community. In terms of how they keep residents safe, every community kind of has their own policies and ways of doing that. So they can probably address that with you on an individual basis of how we make sure residents stay safe, in the least restrictive manner. So that's probably how I would answer that question.
Awesome, thank you. And I never would have thought to listen to the questions that they're asking me, but that's very powerful. And you're right. If all they ask me about is my medical condition and not enough about me and how I'm going to give to the community, it is definitely the wrong place for me.
I have trained hundreds of salespeople probably in my career, and I always want them listening more than we're talking, because we want to know everything we can about you or your loved one. And so, if you go someplace and they're doing all the talking about everything they have to offer, again, I would be cautious about that, because they should be asking you questions to get to know you as much as you're asking questions of them.
Absolutely. Awesome. Well, Dan, I know we're out of time, but I'm going to ask you real quick. What is the price range and what factors determine the difference in cost? I've heard all kinds of horror stories, but basically, what am I looking at and how do I determine the cost?
Great. Yeah, that is a great question. I would say it's really hard for me to be able to give you a price range because prices vary so much across the nation. Depending on what market you live in, a cost of living, prices can really vary. I can tell you in general, independent living is going to be the least expensive level of care, and then assisted living would be more expensive, and memory care more expensive than assisted living. And then if you ever needed skilled nursing care, like 24/7 skilled nursing, that is the most expensive. And so a couple of things you can look for. Most senior livings are going to probably charge some kind of community fee or entrance fee, move-in fee, various terms, and that's typically a one-time non-refundable fee, and that can vary widely in cost. And then you typically will have for assisted living, you'll typically have a base rent that you'll pay, and then some level of care. And companies do this very differently, but usually a level of care charges based on how much care you need based on an assessment, and you pay that in addition each month. Many memory cares are what's called all-inclusive, so they build that that level of care charge right into the monthly rate. I would suggest in looking for a place that you look for outliers. So if you visit 4 or 5 places and one is much less expensive or they're really discounting their rates, I would be cautious of that community because their staffing ratios may be lower, or at least ask a lot more questions about their staffing and what they offer, because there is, a little bit of you get what you pay for in this field. Like, if people are just very inexpensive, they probably are not offering the quality and the value that you're looking for. At the same token, if somebody's very expensive, that's not necessarily a bad thing, but you want to weigh out, are there amenities here that I'm paying for that I'm not going to use? And so, and maybe you determine that higher priced outlier is what you want, but just look at what you're paying for and make a decision that way. I think you'll find that most everyone's going to kind of be in that relatively similar price point when you're looking for a community, but I always say to look for outliers in terms of what you're looking for. But that's a very general way of looking at pricing. Again, it's just too hard to give quotes on rates because of the various markets. I will say that you may feel some sticker shock, for lack of a better word, when you start looking and say, oh my gosh, this is so expensive. And that's why starting this process early is really important. You can map out a financial plan for yourself. You can find kind of a budget that you feel comfortable with that's not going to overwhelm you. And so I think, again, that's one advantage of starting early in this process, because it is costly, and there are long-term care insurance maybe you have already, or VA benefits, but many times for assisted living and memory care, it's always out of pocket. So that's the advice I'd give on pricing.
Thank you, Dan. And I think the difference in the cost of living is true anywhere. If you live in Pennsylvania, if are in Philadelphia, versus where I lived in Pennsylvania was out in the country, I could buy a whole house for what a condo cost in Philadelphia. So, I mean, there
Absolutely.
is always that difference, price difference change. Well, Dan, I want to thank you so much for coming today. It's just been a privilege having you, and I appreciate all the information you gave us today.
Thank you very much, Lily. It was a pleasure to be here.
I also want to thank you, our audience, for being here and participating with us. Dementia Action Alliance is committed to enhancing lives, connecting people, increasing understanding. I'd like to thank you for joining us. And also, I want to tell you there's more podcasts and a lot of valuable resources on our website. Visit us at daanow.org. You can help us continue these programs and these podcasts that enhance the lives of the dementia community with a donation to daanow.org/donate. Thank you. Have a wonderful day.
Stigma from challenge to change, how people exchange, so we live